I'm Celeste Marsan. I'm here for OmniSense Surgical today, and I'd love to start out by talking about an impactful patient story that may include a graphic medical image. Imagine Tina, a mother of two battling breast cancer, who chose a mastectomy as her first step towards a cancer-free future. The surgery went great, and all of the cancer was removed, but unfortunately, 2 weeks later, a complication appeared: mastectomy skin flap necrosis. During the surgery, blood flow to the delicate skin tissue over the breast was cut off due to excess retraction during the surgery. Current gold standard instruments do not supply the necessary feedback in order to allow surgical teams to perform the surgery safely. But Tina is not alone. 1 out of 6 patients undergoing a mastectomy will face mastectomy skin flap necrosis, with devastating consequences, including delays to further cancer treatments, as well as a very large financial burden to all stakeholders involved, incurring over $2.3 billion in financial loss each year in the United States alone. OmniSense Surgical's mission is to prevent mastectomy skin flap necrosis and help patients like Tina not get this complication. Our innovative smart retractor includes novel features that pairs real-time retraction monitoring with intraoperative alerts to surgical teams that allows them to know when retraction pressure is becoming unsafe for the tissue. We're also embedding a camera underneath the blade for increased visibility so that surgeons can easily visualize the far-to-see areas in the surgical field. Our working prototype has been tested in a cadaver lab at MD Anderson with great success. The OmniSense Surgical Smart Retractor is revolutionizing healthcare by bringing handheld intelligence into operating rooms for smarter and safer surgeries. Assembled by the Texas Biodesign Program, our team pairs passionate Texas engineers with an innovative and involved breast surgical oncologist from MD Anderson. The Texas Health Catalyst Mentorship Program has been invaluable for us for our progress this summer and as we move forward. And I want to highlight a key area of this progress in stakeholder engagement. We have done most of our customer discovery thus far with surgeons and surgical assistants from MD Anderson, but we understand that customer needs vary based on hospital levels, funding types, and different experiences. And these customer needs greatly impact clinical adoption, which is going to be necessary to address in our product development phase. We are excited to be completing the NSF I-Core program this October, where we'll be using the excellent advice from our advisors to conduct our next round of customer discovery interviews. We've made great progress so far and are very excited for 3 key milestones coming up this fall, when we'll be completing the NSF I-Core program, submitting our first provisional patent, and applying for SBIR funding. I want to thank you all so much for your attention, and I'm happy to take any questions.
Celeste, thank you so much for that really wonderful presentation. I do have a question for you. As you're showing me the smart retractor and the integrated camera, I think that's really intriguing. And then I start to ask the question in my mind: what's the real prevalence of flap necrosis in this procedure? What are the comorbidities associated with why we would see flap necrosis or not? And then my last piece of the question is why observation of venous congestion, which is typical for diagnosis, why isn't that sufficient, and why do we have to go another level? So thank you.
Yeah, absolutely. Those are all fantastic questions. I hope that I address all of them. Just let me know at the end if I missed one. So first of all, there are absolutely several factors that go into mastectomy skin flap necrosis, a lot of comorbidities, including how vascularized the skin tissue is there a history of smoking, do they have diabetes, like all of these various factors. And one of the very good things about our product as we're first doing it is that we're going to be a surgeon calibrated product. So the surgeons are really the experts on what amount of pressure you can apply to a skin flap before you cause any tissue damage. And they'll be able to know the comorbidities of the patient and calibrate the product accordingly to what level they feel safe of pulling on the skin. As to your second question, I assume you're talking about things like SPY Elite, where you can take an image of the blood flow in a skin flap during a surgery. And while we've seen that in use and it works in patients, we do see that it's often only used either after the mastectomy occurs, when plastic surgeons are choosing whether or not they want to do a reconstruction immediately, or really just as a snapshot of blood flow at the time, but it can't really be used to prevent mastectomy skin flap necrosis, only when they're preventing worsening issues or when they're worried about causing it by continuing the surgery.
Thank you.